Welcome to the program today. Ted Williams with you, inviting you to stay with us as we discuss a very important topic. Some may say it's controversial, but we're not going to discuss pros and cons. We're going to discuss how it affects you today and maybe give you some information so you can make your own decision on some of these things. What we're going to discuss is the Affordable Health Care Act, also known as Obamacare. And I'm sure you've heard about it, but do you know how it affects you? What are your choices? Why do you need it? Do you need it? Those kind of things. Our guest today, Chad Webb, is with the Diabetes Coalition, and Sister Janet Petersworth is with Our Children, Our Future campaign. We want to welcome both of you to our program today.
Thank you. And, good to be here.
You know, what is Obamacare or the Affordable Care Health Act?
Well, the Affordable Care Act is a new legislation. Actually, when I say new, it dates back to 2010, but its focus is preventative health care, so that in 2010 we were able to take advantage of a lot of the prevention kinds of tests and diagnosis that we could do. And then just recently, this particular, in 2013, we got into the health insurance part of that. But the Affordable Care Act has been around for a while and it's done a lot of good things so far.
Does it cost a lot of money to sign up for something like that?
No, it doesn't cost anything to sign up.
Oh.
However, depending on your income and depending on the type of insurance you want, you do have to pay, as you would for any insurance, a premium and some out-of-pocket expenses.
Okay, so if people are offered this and they choose not to take that or another health care insurance, are they fined?
Yeah. The system initially is going to assess about a $95 penalty, but that would be assessed in their 2014 tax return. So it wouldn't be this year, it would be when you were filing your tax returns about this time in 2015. Now that initial amount of $95 or 1% of your income, whichever is greater, increases year by year until it reaches a sum about around $600.
While we're on that topic, a lot of people are probably asking the question, you know, if I'm healthy, I eat good, I exercise, diet, say my prayers, take my vitamins, do I really need to pay money to buy health care if I don't qualify for the free part?
Well, yeah, you can do all those things, but who knows whenever you're going to find yourself sick. Sickness is kind of random. Accidents are kind of random. So just like you have fire insurance and you hope your house is never going to burn down, we have medical insurance. It's just exactly what it is. It's to ensure that when we need it, the money is there.
And medical care is very expensive.
Yeah, really. We have a slide presentation that we'd like to show. This is geared particularly toward the Southern students, but it's good information for their parents or for anybody else in the community. So.
Okay, well, let's see it then.
Okay. The Affordable Care Act, as you introduced it, is its really official name, and it's kind of taken on a nickname, I guess, or a media name called Obamacare. And however, the real name of the legislation is the Affordable Care Act. The next slide, you'll see the president signing it, and with a number of people who helped to make this legislation happen. So, as I say, it's been around for a while. And in the next slide, Chad will talk about some other details.
As Sister Janet mentioned earlier, this law was passed as the Patient Protection and Affordable Care Act back in 2010. It instituted a lot of different programs, namely consumer protections. Some of the big ones on that are insurance policies are no longer able, or insurance providers aren't allowed to discriminate on the basis of having a pre-existing condition. In addition, it also bans lifetime caps on policies. Some people would have healthcare costs that would hit this maximum and basically the policy just quits working. So that's been refined. Now, the next sort of element on the slide talking about the cost, the cost of the health insurance is subsidized depending on income and household size. All of that is based upon the federal poverty level. So, so for instance, Medicaid in the state of West Virginia, you can get up to 136% of the federal poverty level. And then beyond that, you move into what's called the qualified health plans. And those are subsidized health plans that have money to assist you in paying your monthly premiums, and up to a certain point, up to a certain income point, has money to assist with premium payments and co-payments, like your out-of-pocket expenses with your insurance.
So as you just mentioned, they're not allowed to discriminate against pre-existing conditions anymore. So I imagine, and from what I understand so far, I know we're in the early stages, but a lot of people that haven't been to the doctor before are now starting to understand that they can go to the doctor and not have to pay all this extra money to at least get a physical and see how they are.
One of the important things about this legislation is it's trying to get people funneled into what they call primary care. It's what you were talking about, is a person who just can't see a doctor on a regular basis. And the thinking behind that is, if you catch a problem early and you catch and you see a physician that can manage it a lot better than just going to the ER occasionally, that's going to be a lot. You're going to get a lot of healthcare savings out of that from just regular medicine and small doctor visit fees, rather than ER visit bills that can range in the thousands to tens of thousands of dollars.
Sure. You have more in slides?
Yes.
As I was mentioning earlier, the fines do run from $95 on your 2014 tax return. All of these penalties and everything are funneled through the IRS. So any money that you would owe, or if you actually overpay for your health insurance, any money the government would owe you would be brought through your tax return, either as a credit or you owing the federal government taxes. And as I noted earlier, it goes from $95 up to $695, or 2.5% of family income, whichever is greater in 2016. And this next slide, this is just some of the basic terminology for dealing with the health insurance policies that you'll see outside of Medicaid through the exchange. Health insurance premium is just the monthly payment you typically pay just to be enrolled in the plan. Co-payment are the payments that you most often encounter as your out-of-pocket costs. That is, the $5, $10, $15 you have to pay when you visit a doctor, or the $5, $7, $20 you have to pay for a prescription when you pick up a prescription or something like that, or costs associated with various lab tests. Your deductible is the amount of money that you have to pay typically before the insurance coverage starts. They start, covering the cost. And that can range anywhere from $100 to several $1,000s, depending on which plan you select in the exchange.
Mm-hmm. And so when you select a plan, that depends also on the premiums you're willing to pay, right?
Yes.
And what you'll see on the website, or if you call the federal 1-800 number, or you receive documentation saying you've been accepted for one of these health plans, is you'll see what the cost will be normally, and also after all of the subsidies are applied. So there's a lot of stuff on the internet right now that's quoting people, prices, what their suggested monthly premiums are going to be. But we would advise that they actually get in contact and speak with someone at the Federal Exchange, or an assister like us, to see what your actual healthcare costs will be, because those online calculators don't take in fully all the subsidies that are available to everyone.
And I can imagine some of the college students are saying, how long can I stay on my parents' plan before I have to get my own?
Mm-hmm.
Yes, and that's a good question. And they're also asking just the question you ask. I'm young, I'm healthy, I eat right, why do I need insurance? And the next slide says pretty much what I said at the beginning. So if we can see that, yes. Why do you need it? Well, because life happens. Because you might fall down and break your ankle. or you might have a very bad case of the flu, or you might get a rash, or you might have cramps, or you might be pregnant. All those reasons are reasons why we all need some kind of insurance. And so life happens to college students that are young and healthy and eat right, just like it happens to somebody that's, you know, a senior citizen. And so let's take a look at the next slide. So how expensive is it? Well, a hospital stay can be very expensive, and this particular slide gives you some estimated costs of what it would cost you, say, if you had a gallbladder attack and had to go have your gallbladder taken out. Or let's say you were hospitalized for something wrong with your digestive system. So these are just examples of how much that can cost you. Well, none of these insurance policies that are being offered under the Affordable Care Act come anywhere near costing that. Mm-hmm. So I think that's an issue. And in the next slide as well, childbirth. There you go, normal delivery, normal with complications. C-sections can run you anywhere from $10,000 to $29,000. And if you don't have insurance, that's a big bill, and you're going to be paying it off for a long time. So I think Chad's going to talk a little bit about how these students can afford health insurance.
Yeah, on this next slide, there are a lot of options for students in this area for having some sort of health care coverage. You sort of mentioned it earlier. One of the main ways they can do it is remaining on, the ACA actually extended this age. You can stay on your parents' policy all the way up to age 26. That was one of the very first things that came online after the legislation was passed in 2010. Another option is buying a student plan that's offered through Southern West Virginia Community Technical College. There's also the Medicaid program if your income falls below that $15,856 per year. Of course, that is a no-cost health insurance. There's no monthly premium associated with it, and what co-pays are associated with it are very minimal. And then the last option, if you make more than that, you go into what they call the exchange, which allows you to purchase private policies with various subsidies both towards the premiums and the co-pays. On this next slide, talking about staying on your parents' policy, if your parents do have insurance and you're a young adult under the age of 26, you can remain on your parents' insurance.
Whether you live with them or not? Or?
Live with them or not.
Okay.
Whether or not you're married. And yeah, so this is it's a very good option. It's very easy to take advantage of, and of course it incurs no additional cost. It's just like you were on your insurance when you're a teenager.
Sure.
This next option is buying a student policy through Southern West Virginia Community Technical College. Southern does offer a plan through Gallagher Coster Insurance Company. Now, the student plan has variable costs depending on sort of what options you choose.
Right, we were talking about this before the show. Some colleges, they automatically give you the insurance as part of the tuition, mm-hmm. and if you don't want that insurance, you have to opt out. Mm-hmm. At Southern, if the students ask about it, we can give them the information, but they still need to arrange it themselves, so mm-hmm. or stay on their parents, or they can shop. Yeah.
Mm-hmm. If you bring back the slide. Now, of course, this is something you're going to want to talk to the registration people about if you are interested in this option. If you advance to the next slide, yeah. We have another option.
The other option is related to Medicaid. West Virginia was fortunate in that our governor decided to expand our Medicaid, the amount that you can earn and still get a West Virginia medical card. Not every state did that. And I think that was a really, really good choice that he made. A West Virginia medical card has, if you qualify, if you're an individual and you make less than $15,856 annually, or $1,321 a month. If you qualify, that is health insurance coverage at no cost to you. There are some co-pays, out-of-pocket expense, but they're minimal. And this is excellent coverage. It was before, the amount that you could earn was very limited. If students are working, for example, at fast food places and part-time and coming to college part-time, my guess is that they would not make more than this $15,000. It's almost $16,000 actually. If they are a single mother or father with a child, they'd be counted as a family of two. They could make up to $21,000 and still qualify for a West Virginia medical card. And a family of three, let's say you're single and you have two children, or you have a mom and a dad and one child, and you're a student, and the family doesn't make more than $26,900, you still qualify. The expanded Medicaid, I think, is really, really a good option. So we'd want students to think about that and to look at that and see if they qualify for that medical card.
Advancing to the next slide. Your options, if you don't qualify for Medicaid, or you don't purchase insurance through Southern, or you don't have insurance through your parents, is to go into the health insurance marketplace. Everybody's probably heard about healthcare.gov. That's the primary way for West Virginia residents to sign up for these health insurance. They're called qualified health plans. Now, these run, the subsidy premiums we were talking about run all the way up from 136% of the federal poverty level all the way up to 400%. So for a family of four, you can receive some sort of subsidy almost up into $80,000 to $90,000 a year range. So there's subsidies available for a large percentage of the American population and a large percentage of West Virginians. Now the way that's going to work is it's a sliding scale. So as you make more income, you get less subsidy. But between 136% and the 200%, you get additional subsidies on top of just your premium subsidies. And for a lot of people that are working service industry jobs, minimum wage jobs, and just happen to be based on the size of their household, happen to be making more than the expanded Medicaid cutoff, the cost can be pretty minimal. We're talking between $30, $40 a month, up to $90 a month. And of course, that's depending on the size of your household, where you live in West Virginia, and also how much you make. So it's a really good set of options.
And as we mentioned at the top of the program, one of the messages that you're trying to get out is that you have to have some kind of insurance, or you're going to be fined.
Mm-hmm. Yeah,
some kind of health insurance that qualifies. You can't just have anything.
That is correct. Has to meet the essential requirements of the Affordable Care Act.
Okay.
Yeah.
And that's what you're saying is listed here on this website?
Those 11 policies are listed on the exchange. That you reach those by the 1-800 number, the federal 1-800 number, or healthcare.gov. And we have 11 different plans offered by Highmark, Blue Cross Blue Shield. All of those meet the standards, even the cheapest plan. Now, what's going to happen is, as you move through those plans, premiums are going to increase and the level of coverage you receive is going to increase. But the bare minimum one basically covers you for what they call catastrophic events, which is basically getting hit by a car, or having a serious injury, or being stricken with a serious illness. What that's going to do is you're going to have to pay a lot of out-of-pocket costs. Once you hit this threshold, the coverage begins to cover 100% of your costs. So you're going to have not a huge amount of cost up front, but it's going to prevent you from having those $40, $50, $60, $70, $80,000 hospital bills for just some unforeseen event.
And I think you can have 3 visits to a physician in the course of a year with that catastrophic plan. That plan is for sort of a limited population, though. It's for the younger people, those people that you're talking about, that don't think they're ever going to get sick. So, you know, it's something to look at. It has not been very popular in West Virginia. We got some statistics today, which I think are interesting. So far, over 18,000 West Virginians have completed applications, and that represents 26,800 people. So that would be, you might complete an application, but there might be 2 or 3 people on your application that are going to get covered through that. And we have another 10,000 plus who have qualified for the expanded Medicaid. And so we're very interested in trying to get people to go on and get signed up, because sooner or later they're going to have to do it. And I've run into people who will say, well, you know, I don't want the government telling me this. Well, we have to have automobile licenses. They tell us that. There are other things that are laws that we comply with. And so this is the law. And we can debate it all we want, but it is the law right now.
Okay, any more slides?
Excuse me. Yes, if you'll go to the one about prevention. We said earlier that already in 2010, the new health care law emphasized the prevention. So Americans can now have annual preventative care. They can visit their physician, and they can have tests such as mammograms. They can have other tests that would be related to, say, pre-cancer kinds of conditions. These are basically free. The insurance pays for them completely.
These are on all the qualified programs, or this is the ACA?
This is under the law. No matter which program you qualify for. These prevention things are there for your taking. The FDA-approved birth control pills and devices are preventative care, and they're fully covered, and 62 different types of screenings that you can have. So that's been around, but I don't think the general population really realized that and has taken as much advantage of that as they might.
Right. Well, probably a lot of people are wondering, you know, this sounds like something I could qualify for. How do I get involved in something like this? I need help. Is that where you come in?
That's where we come in, and that's where the website comes in, and that's where the 800 number comes in. All of those things that Chad has been referring to, the healthcare.gov. I did not bring the 800 number with me, but we can give it to you.
Yeah,
there are people in all communities around West Virginia like us who are here to assist people. And we will be assisting students who want to sign up for this at the end of the month here on the Williamson campus. I believe it's the 28th of January, and the Logan campus on the 29th. And we'll be in the lobbies or the foyers or wherever the students gather to answer questions and to help them sign up if they like.
And before that date or after that date, they have questions, or they might have 1 or 2 questions if they need help. How can they contact
the last slide that we have, that is talking about consumer protection. You can't charge women more than men now, and you can't refuse to sell a policy to a sick person. These are some of the pieces of the law that we've already referred to. But if you go to the well, hello, that's, if you've got any questions, go to the next slide after the little dog, and there are our contacts. Chad?
I can be reached at the Diabetes Coalition. The number there is 304-235-3400.
And I can be reached with Our Children, Our Future at 304-393-1481.
So
we'll also be scheduling different educational events around the area. We have presentations to sort of go through this same information to people who might want to know more or have a face-to-face conversation about it. And we'll also be having different sign-up events in the community, not just in Mingo County, but the surrounding counties.
Yes, and both of the hospitals, ARH and Memorial, both have people who are qualified, who work at their hospital, who are also available for consultation or to help them sign up. And we have an in-person assister at the DHHR office that I mentioned earlier, and that's Keith Blankenship, and he can be reached through the DHHR office.
Okay. Do most hospitals have someone that would qualify?
Yes, and
So-
health clinics, yes.
Health clinics and, okay, and DHHR branches
Yes,
around?
yes.
If they don't have a navigator on site, they can get you in contact
They
with
can get you
someone.
in contact with someone.
Okay, great. Well, we appreciate you coming and getting this message out. I'm sure a lot of us learned a lot about this. We hear a lot about it, but we really don't know the nuts and bolts, and that's what you're sharing with us. And for those who have just tuned in, you can contact either Chad or Sister Janet or one of these phone numbers or websites to get more information about it. And we really appreciate you coming and spreading the message for us.
Well, thank you for
Thanks
this
for having us.
opportunity.
And we want to thank you for watching and invite you to join us again on our next program.